Syndrome and metabolic disorder is a major concern, and since obesity is related to it. So, coming to the point of the real state, how the real state today has in its vicinity all the healthcare, it's made more healthcare centric. So, in terms of metabolic syndrome, is there any kind of a plan or a vision to create such vicinity centers of treatment or centers of diagnosis in the vicinity, as is the case of other hospitals in the vicinity near schools and malls?
Are we ready?
Yes, sir.
India is considered the diabetic capital of the world. We all understand the difficulties in terms of diabetes, all the complications that it entails, shortens lives, brings about debility, morbidity of all the organs of the body, and unfortunately, a lot of people's lives are shortened because of diabetes. Today, that conference that we have held is to look at this thing and stare it at the face as to what are the solutions really to take care of diabetic care. We in these hospitals, whether it's Dr. L.H. Ranandani hospitals or all the other hospitals which are there in the vicinity and all over the country, are focused on taking care of diabetic patients. The paradigm is already happening. We have better medicines, we have better care, but diabetes is not sufficiently taken care of by medicine alone. It requires a lot of care by the patient themselves, to take care of their diet, take care of their exercise, take care of their lifestyle completely. All this can be done in India because we have more diabetic patients than anywhere else in the world, and we really need to focus on this subject. So I'm happy to say that this conference here today is focusing on the issue of metabolic problems in this country, and I am certain that with the leadership that we have in the medical fraternity, we will find solutions to diabetes in India. We have to. We have done care of so many other complicated diseases, and we have relied on the Western world to do it. But as far as diabetes is concerned and metabolic problems, the other countries are not so seriously affected. We are much more seriously affected. Hence, my congratulations to the hospitals which are doing all this activity over here, and hence they must be complimented. But we need to move ahead much more on the research in these areas in order to find a solution to the problems, not mitigation of these issues.
Is there a gap, and how would you like to fill that gap in terms of fellowship programs, stewards program? And obviously, the second part of the question is that obviously body like IMPA has now come into being. So how would they carry forward this?
So IMPA is definitely committed to this issue, and I'm sure they will answer it better themselves. But the idea basically being it's a problem of the country. Each and every one of the citizens are affected. The leadership of the country is affected. All these problems are affected. Look at the time of COVID. It was those patients which were affected by diabetes which had higher level of deaths in the country. So hence the complications which have taken place are multiple in terms of all those activities. Hence the care to be taken in terms of whatever it is much more serious. As far as the fellowships and other concerns are concerned, I think the focus in our hospital has been on diabetic and metabolic care, and we are much more focused in the last 18 months or so, where we have taken it as a prime objective in order to see that diabetic care, metabolic care is heightened to the extent to which we believe that we want to create centers of excellence. And I would really call upon all the other hospitals to do the same, because it's not just one hospital that is going to do it. It's government hospitals, private hospitals, municipal hospitals, institutions, research centers of these pharmaceutical companies also need to focus on that part of it. And I think we will succeed. We will, and we shall. And up till now, we took for granted that it is okay to have bad diabetes. People say चलता है, सबको डायबिटीज़ है, मुझे भी है, इसको भी है, इनको भी है, डॉक्टर के पास जाते हैं, हम दवाई लेते हैं, सब कुछ ठीक हो जाएगा. In reality, that is untrue. The focus on today's conference, the focus in our hospital is to enlighten the patients, to signify to each and every one of the citizens of India that if your family member has diabetes, let's take care. There is a solution. There is a solution to the problems where you can mitigate this issue of diabetes. Take care of your relatives, take care of your parents, take care of your siblings, take care of your children, take care of your grandchildren, take care of all of them. We can solve the problem. That is the most focus area in this, what we are doing. Our hospital, as you asked before, the Hiranandani Hospital is now taking care of creating processes which we can do. The Hira gain that we really need to do in terms of taking off all these problems to do. Weight loss is becoming a very important thing. It sounds sexy that to become losing weight, but it's so important for a diabetic patient, not only from a point of view of looking good, but actually to take care of their diabetes. I think all that is extremely important today.
Thank you.
Yeah. The Dr. L.H. Hiranandani Hospital does Hiragain entire set of processes and procedures we have already laid, and I'm sure that the other hospitals and doctors will also take advantage of the things which we have done. We are open to share our ideas and thoughts with other people and really prescribe all these thoughts to the rest of the other hospitals, the other doctors and the country. And this conference is actually going to be the cornerstone of starting this off.
Today is the launch of this IMPA. Dr. Bhattankar, could you please highlight
Yes.
what is the objective of IMPA and how it wants to take it further?
Is it the first of its kind
Association
in India or globally? Because IMPA, the name itself, International Metabolic Physicians, sounds very very insightful actually.
Because we have, as sir was saying, we have a diabetes focus associations. But diabetes is not a solitary problem. Diabetes, obesity, cholesterols, then polycystic ovaries, there are so many other things which go hand in hand. They are almost like cousins. So to tackle all of them together and face them head on. So that's why we have formed an association called as International Metabolic Physicians Association. So metabolism involves everything of this. And that's why we have taken this as an initiative. And as sir was saying, in Hiranandani Hospital, we have started a program called the Hira Regain. So regain your health. And we are tackling all these problems together. And this is first of its kind of a center and first of its kind of an organization where we are trying to tackle not an individual disease per se, but collectively we are trying to tackle this problem.
Will you go national soon? Other cities?
We have got our mentors are from Canada, from Germany, and we have got Dr. Anup Mishra from Delhi, Arya Sharma from Germany, and Dr. Larry Cheskin from USA. So we are already having members who are from all over the world, and we are going by strength because this is the first conference where we have people from all over the country. Dr. Neeta Deshpande is a stalwart from Karnataka and Belgaum, and she is a well-known all over India, and she has joined as a member of RSSDI, which is a primary organization. So we have got people from all over all walks of life, basically all specialities, and we have people from respiratory medicine, nephrology, all sorts of things who tackle metabolism. So that is the idea of IMPA.
What is the member count for how many members are there?
Members, where permanently they will be like for education and collaboration, and others are educating members. So they will get a lot of inputs from these faculty members, and so that they can implement that into their practice.
Okay. Sir, as far as
All the research which is happening, India is one of the major centers of this research. So we get first hand. Nowadays it is not that something happened in America and now it is available in India. At the same time, we get all the research material here. We are part of that research and we are evolving.
Message. Yeah.
Well, the idea basically is that we can do it. There we need participation of the hospitals, the government, the doctors, the pharmaceutical companies, but mainly enlightenment of the patients themselves. Because there is so much disinformation about diabetes and the fact that it is okay to have diabetes and there is no need to really get out of it. I think this message is the most important message that we will succeed. Of course, I'm focusing on diabetes, but the entire range of metabolic problems is actually most important. But the general public knows it more as diabetes than the entire range of metabolism. But this association relates to the entirety. To hospital, 10% of them require amputation of the foot. If they come to our hospital, it will be 0.01%. So when you talk about super specialization, we are already in the field of super specialization in this field. But that's not enough to have it in Hiranandani Hospital. We want it to be throughout the country. Why should the percentage be 10% when we are less than 1% in terms of such things to be done? So there are many factors where within our control, within our studies, within our research, within our availability of knowledge in terms of treatment, we are able to save lives, save people from an amputated foot. So that's the big difference that we need to do. So while I agree there should be super specialization of hospitals doing only metabolic problems, I don't agree that it can be only a few hospitals in India which can solve this problem. We need to have centers of excellence in every hospital. That's one. Obesity in terms of what are the consequences of it, that is can be cardiac problems, which can be metabolic problems, which can be other problems relating to other diseases which are there. So as I just heard a story where they said that if you're obese, even your eyes can get affected after some time because of the obesity. So what we are saying is obesity itself is a symptom which causes multiple problems. But in the metabolic field, it's a much bigger issue than in the case of other issues. So tackling obesity becomes necessary for everybody, but some people think of it as a cosmetic issue, and other people should really look at it as an issue to have good health and be able to live longer and healthier.
I will say no, because the baseline is your lifestyle. Whether you do bariatric surgery, you do whatever, you have to still maintain the lifestyle, and that's where our thirst is. Of course, pharmacotherapy will help you. These are adjunct to whatever you are doing. The lifestyle is the main thing which we are focusing on. Apart from, yes, there are a lot of comorbidities. If you have you can't lose weight with all the available solutions you have, then of course you have to do the bariatric surgery. But I think the major focus and thrust should be on the lifestyle change.
In many patients, in spite of doing bariatric surgery, there is reoccurrence. Because if they are not maintaining the lifestyle, it is just like once again back to normal, back to same point.
And what about the fast food culture? Nowadays, the fast food culture has become more eminent. So, how to tackle this? Can you give some suggestions?
It's part of counseling for lifestyle. So, a large part of awareness plays a big part. And as Sir said, government policy, cutting down on sugars or labeling sugars as dangerous foods. This is all government policy and part of that. So if that comes in, then definitely we will be able to tackle even fast foods and that kind of culture which has to come in from many. It's a multi-pronged approach.
Nowadays, see a lot of fast food joints or hotels have calories mentioned on them. So that's just to spread the awareness of what you're eating. There's no mindfulness when people are eating these fast foods. So just to create a mindfulness, mentioning calories and how bad it is for your health is very, very important. Like you have statutory warning for smoking, I think there could be statutory warning for food. So I think food is a bigger addiction than smoking. So I think that's more important that we should have a statutory warning for all these foods which are available.
Thank you.
I can just add to what I'm Dr. Manoj Chawla and I'm invited here to speak. Well, and I begin with let me congratulate IMPA and Hiranandani Hospital for the great work, and it was a pleasure to listen to what's been said, and completely agree with Mr. Hiranandani about it's not one hospital, but every hospital which should have a specialized center. I'm attached in Mumbai to both Raheja and Hinduja hospitals, and we did start off Raheja Hospital as a specialty center, but today it's converted into a multi-specialty because again it's not right to focus on one disease. You will have cancer, you will have other disease. So every hospital putting in effort, and as I said, amazing to see the kind of work that Hiranandani Hospital is doing. We're speaking about the fast food culture. I think one of the aspects which is already taking care is in the schools. And today, we see policies in the schools where fast food is done away with, and I think that's the right approach, because it's the younger minds and children which will not only accept those changes but bring about those changes in their own homes. And it's the reverse thing. You know, there was a time that we used to tell our kids what to do. Now it's the children telling the parents as to go away with unhealthy habits. So I think that is a great strategy, and moving away just from looking at diabetes but focusing on the overall problem of metabolic disease and syndrome is probably the right way for making India diabetes free and a healthier nation.
So
Thank
what
you.
about taking this issue to the central government? They have, and you know, asking them to have a separate allocation in the budget and to
I
get this
think
issue.
the central government is already aware about it.
Aware.
However, the focus just now may not be on this. General health has been the focus recently by the Prime Minister in terms of seeing that health, taking care of this, of each bill there. I think bringing the attention through our association to the central government will become very important. That in reality, if we take care of metabolic health, diabetics and all, the number of patients who will have other complications will come down. So you won't have other problems where you have a loss of so many organs that take place just because you have diabetes. So a focus on diabetes through the central government movement is absolutely imperative. And as we said just now, education becomes very important to be able to educate people as to what they need to do and why it is possible to take care of their health, and metabolic care that we really need to do is not impossible to do so. But the government, of course, will take a lead in that.
If I may just add a point about IMPA, when we studied medicine, and even to this day, metabolic medicine is not part of the curriculum even at the undergraduate level nor at the postgraduate level. So we felt that through IMPA we can have different kinds of training for healthcare professionals to become aware of metabolic diseases, and to that end we plan CMEs, we plan fellowships to sensitize healthcare professionals, general practitioners about what metabolic medicine is all about.
So we continuing to Madam's thing, we have introduced India's first introductory course of metabolic medicine to create the awareness for the physicians of India. And within a less period of time, in less span, we had more than 6,000 registrations who have been enrolled and they have completed their course on this metabolic
We
medicine.
already done it.
And we have plans for advanced courses on metabolic medicines as well in the future.
Vimal, you have with MUHS program going. Would you like to
So
highlight?
we also have the diabetes and fellowship program in hospital, of course, but we also have obesity fellowship program. Obesity and body metabolism, which we are giving fellowship courses. Which I think none of the hospitals has this of the fellowship. Only few hospitals are offering, but we are one of the centers. We are offering these courses. People are not yet aware, and obesity is such a disease. The physician itself are not aware how to practice, how to go about practicing. The knowledge is scarce, and nobody is right now ready to take the obesity as a subject. Because of lack of pharmacotherapy, what they are going to treat patient as only lifestyle management. So we need a lot of research as far as pharmacotherapy. We need a lot of research from India. We need a lot of such courses, awareness for the patients as well as the physicians alike. Right now, the physicians themselves are not aware how to go about and treat such patients. It's a challenge. It's like elephant in the room now. For us, most of them they have challenges in treating the patients. So we need more such courses which we have, and we are doing one of this.
So there's a lot of doubt around this diabetes remission. Diabetes remission.
Is it
And
remission? Pre-diabetes is 136 million in India.
So
the study has
diabetes
said.
This-
Pre-diabetes. So it's
diabetes remission, this kind of
Yes,
this kind of
diabetes
misconception.
remission is like recently, Dr. Roy Taylor from UK created kind of awareness that you can remit diabetes with the help of lifestyle. Earlier, bariatric surgery was only touted to do the remission, but now with lifestyle changes, we'll see with having low.
Is it possible?
So it's possible. It has been seen in the clinical trials. And
In the clinical trials only.
Yes.
No.
These are real
It's
trials.
real-
These
it's a real-
are real life. These trials were done in the primary care cases where no one was supervised.
Okay.
They were only locally dies.
It is not cure. Basically, people feel that is a cure.
Acha.
It is not cure. It is like asthma
Is it-
going into remission. It can
Is
appear.
it preventive or what do we say,
So there are two
therapy.
aspects to it.
It's a
One
therapy.
is a prevention, one is a remission. You get diabetes, you can remit it. You're not diabetic or pre-diabetic, you can prevent it from getting a diabetes.
So I'm glad that you use the right word, remission, rather than the commercial word reversal.
Reversal.
Right, so which is what people get enticed
Yeah,
with
that is
when-
what misconception
when
is there.
When they do an internet search or they open up Facebook. So remission, yes, it's shown and not only in clinical trials and a lot of clinical
Yeah.
work. And we have few individuals here, Vimal, Neeta, Patankar, all who are working in the diabetes remission area and doing great work. But we need to understand that remission will be achieved in a certain percentage of population. Everyone with diabetes today may not be able to get remission, and
The
hence
idea is to
the treatment.
remission. In certain patients, idea is to control it. So strike a right balance. Looking at the patient profile, it's not remission to be for everybody. People with lean diabetes or type 1 diabetes, they should not remit diabetes.
Yes.
See which patient and accordingly advise whether you are for remission or you for control. So I think right balance is very important.
Customized.
One last question.
सर
So we can-
आजकल जो है वो यूजुअली टाइप 1 डायबिटीज़ होता है, उसे ऑटो इम्यून डिसीज़ कहते हैं। वो आमतौर पर जो हम डायबिटीज़ देखते हैं बुजुर्गों में या ओल्डर एज में बहुत अलग होता है। वो डिसीज़ ही अलग है, उसके कारण ही अलग है। सो उनको इंसुलिन ही लेना पड़ता है क्योंकि उनके बॉडी में इंसुलिन का उत्पादन होता ही नहीं है, तो इसलिए उनको इंजेक्शन लेना पड़ता है। बट ये वेट लॉस बहुत ज़रूरी होता है।
Thank you. Thank you.